Welcome to Adapt NCLEX. In these 85 questions, we're going to cover multiple systems from endocrine, cardiology, pharmacology, mental health, engineering, all the systems that you need to answer questions on the NCLEX. Treat this as a mock exams. Stop the video, answer the questions on your own, and then listen to the way I'm going to approach it. Keep your score, and I want you to score above 65. You know you are on your way passing the NCLEX. Stick around. Grab your pen and paper, commonly tested concept on the NCLEX. Let's get to it. First question, what do you see? This looks like risk reduction question, but it's an endocrine question. Most of the endocrine questions are the risk reduction. What do you see? A client with SIADH has the following lab. It's a lab work. You have to interpret it, but you don't have to worry too much because what? You have SIADH over there, sodium 124, potassium 4.1, chloride 92, BUN 12. Which nursing action is a priority? Encourage increased oral fluid, restrict fluid, and monitor for neurological changes, administer potassium supplement, encourage high sodium diet only. Stop the video, answer the questions on your own, and then approach it the way I'm going to do that. After you pick your answer, you select your answer, good. Give yourselves a few seconds and then pick your answer. Now, if I'm taking the NCLEX, this is the way I'm going to approach it. I'll read the question from the back. All the questions, do it the same way. If you practice it and you're taking the NCLEX, it becomes part of you. I read the question from the back to figure out what is being asked. Which nursing action is a priority? I know all this may be right, but I got to pick the best one. A client with SIADH, I should expect certain things about SIADH. What is the problem? The sodium should go low because you're retaining fluid. Osmolarity of your blood is going to go low. Your urine specific gravity is going to increase. And your urine sodium is going to be low. What do you think? You're already fluid overloaded because you're retaining fluid. Encourage you to take more fluid is wrong. I'm going to restrict the fluid, but because of your sodium that is low, you're going to have seizures. Potassium is within normal limit. I don't need to worry about it. And I'm not going to increase high sodium diet only. There's so many things I can do. And therefore, your right answer is number 2. This is the way you should approach every question you see, and you see that it becomes part of you, and you'll be able to answer it flawlessly. Next question. This is also risk reduction, but there's a concept here. Which of the following prescription is appropriate to administer? Select or apply. You don't have to pick everything. Pick those you're confident so that you don't lose points. And this is reviewing medication prescription for pediatric client. 1, aspirin for a 2-year-old with influenza. Aspirin for a 2-year-old with rheumatic fever. Aspirin for a 2-year-old with RSV infection. Aspirin for a 2-year-old with Kawasaki disease. Aspirin for a 2-year-old with otitis media. There's a concept here. Stop the video, pick your answer, and let me know. You select your answer? Excellent. Keep your score. What do? Let's break down the question. Every concept, every question, I will break it down and I'll give you concept. And I want you to write the concept down as something you're going to use to learn. Select or apply. I'm not going to pick everything. Which of the following is appropriate? That means not all of them are appropriate, or all of them may be appropriate. The next is what? Reviewing pediatric client. Okay. Aspirin. All of them, they are taking aspirin. All of them have 2-year-old. Therefore, what is the problem? Influenza. This is a viral infection. Rheumatic fever is it's not a viral infection anymore. It's not an acute condition. The acute condition is already resolved. Now you're having the autoimmune associated to the disease process. Your body is fighting against the infection that you had, right? This is RSV. This is a virus infection. Kawasaki also be viral infection. But what is the problem? Otitis media can be viral, it can be bacteria, but most of them are bacterial infection. Now, your next step is what? Ask yourself. We all say aspirin is bad for kids. Okay, fine. Especially if they have viral infection. But the problem is there's an exception. If it's just for fever and pain, yeah, choose Motrin, ibuprofen. But it's for preventing bad problem like cardiac infection, joint, or kidney issues. Yeah, you can use salicylate, aspirin product for kid. What is the problem? Influenza, when I'm giving you aspirin, is for fever. Therefore, you should not give it to a patient who has a viral infection. Rheumatic fever, if I'm giving it to you, I'm preventing the inflammation that's going to cause cardiac condition. At the same time, it's a late manifestation, so it's not a true viral infection. But the most important is because of the cardiac. I want to prevent cardiac manifestation. The carditis associated with the rheumatic fever, that's what I'm worried about. I don't want the kid to have a heart problem and deal with the inflammation. Therefore, what am I going to give the patient? Aspirin product is okay. RSV is an acute viral infection. You should stay away from aspirin. Kawasaki, the same thing, is a viral infection. But what do you worry about? The cardiac manifestation of the disease. Therefore, thus, you can give them aspirin. Otitis media, most of the time, is bacteria. But even if you need to give them aspirin for the fever, you should not, because you're just giving the NSAID for what? Fever. Therefore, Motrin, ibuprofen is the best answer. So let's recap. In this condition, cardiac manifestation, bad problem, you have to give them aspirin. If it's for fever and pain, give them Motrin. And also think about viral infection. Rheumatic fever, safe to give them aspirin. Kawasaki, safe to give them aspirin because of the severe inflammation. And if you deal with the inflammation, the kid is good. You see these questions before. Indicate whether condition has improved, remain unchanged, or worsened. These are next generation kind of questions they may give you, and you don't know what to do with it. Look, it's straightforward. There is a condition. Case, I give you a case. Client admitted to the medical surgical unit with acute exacerbation of COPD. On examination, the client report increased shortness of breath and productive cough. What is the vitals? Respiratory rate of 28, saturation 89, rheumatoid, lung sound, expiratory wheezing bilateral. Patient is coughing, take green sputum, and a heart rate of 110, blood pressure 168/98, and urine output of 20. What did the nurse do? The nurse initiate prescribed intervention, including oxygen, bronchodilators, and then encourage effective coughing. 6 hours later, the respiratory rate is 22, saturation 94 on 2 liters, lung sound, wheezing and crackles, blood pressure 175/98, cough, take green sputum, the heart rate 96, urine output of 55. Now, look at it, stop the video, read the case study on your own again, and then figure out what is going on. Now, which of these conditions has changed, remained the same, or worsened? All you need to do, go back to the case, look at the scenario they've given you, and see if they has changed. Oxygen status, what does that mean? What is the oxygenation? Saturation of 89 rheumatoid. Now it's 94. This patient has improved. Lung sound, what does it sound like? Expiratory wheezing, and then we have wheezing and crackles. Now there's crackles added. That means there's more fluid, not just wheezing. This has what? Worsened. Sputum quality. Take green sputum, the same sputum, therefore unchanged. Blood pressure, control. Blood pressure 168/98. This has 175/98. Systolic has increased. We have what? Worsening. Cardiac workload. What represents your cardiac workload? Your heart rate. Therefore, look at the heart rate. What is the problem? 110/96. It has improved. Renal perfusion. Kidney function. How do I know? Urine output. 20/50. This has improved. This is the way you answer this kind of question. When you see it, there's a change. If the change is within normal limit, then consider it as unchanged. From probably your blood pressure went from 89 to 90. It's still within normal range. You can say unchanged. But watch for this kind of question. Don't trap yourself. Adapting class. next generation NCLEX. Another one. This is mental health. Small mental health information to help you. This is a question that can show up. Watch for this kind of question. It's a trap. Pay attention. A nurse is collecting data in an outpatient clinic. What condition the nurse should suspect the client most likely experiencing? I click on it. 60-year-old client, report of not feeling well since the spouse died in an auto collision 5 months ago. Client cannot think of anything else except the death of what? The spouse. Client has what? Avoided social contact and feel debilitated and wonder if things will what? Get better. No suicidal ideation, no hopelessness. Physical exams is normal, except sad mood is oriented ×4. What do you think? Depression, normal grief, acute distress disorder, post-traumatic stress disorder. Stop the video. Let me know what you think. This is something I want you to pay attention. Watch this portion of the video multiple times. You may get it in your test. Be careful. Now, you pick your answer. The idea of this question is not everything is depression. Watch for it. If there's a trigger, what was the trigger? Somebody died. And what is the matter, the person doing? The spouse died. It's been 5 months after the accident and still worry about the death. Complaining. I've avoided social contact. I feel like I'm losing everything. I wonder if this is going to get better. But there's no suicide. He has no hope. Patient does not have any hopelessness. This is not depression. You can give them up to 6 months. This is not depression. This is not post-traumatic stress disorder, because you will see 3 things that will happen. She's not reliving the situation. She's not avoiding anything. And this is not acute stress disorder. This is what we call grief. She has uncomplicated grief, normal grief, later grief, and then pay attention. When you see any question like that, that's what you should watch for. They will trap you. They will trap you. They will trap you. It's not depression. Now, I put everything together. A learning process. Like I said, use this as a mock exam. Stop the video, score this one, and see what is your score. But this question, very important. Mental health concept. And then she's providing care to a client experiencing loss. Match each client situation with the type of grief they're demonstrating. Click on it. Number 1, 40-year-old client, spouse died suddenly in a motor vehicle accident 2 weeks ago. The client stated, I can't believe this happened. I keep expecting them to walk through the door. They did, right? The client avoids discussing funeral arrangement and says the doctor must be wrong. What do you think? A parent whose child died 10 years ago continued to keep the client bedroom unchanged and cries daily. The parent reports inability to form new relationship and state life stopped the day my child died. What do you think? A client whose partner is diagnosed with advanced Alzheimer's disease state, I feel like I'm already losing them, even though they are still alive. A client recently diagnosed with metastatic cancer report intense sadness, anger, and insomnia. The client states, I am grieving. The life I thought I would have is gone. A client's sibling died 6 months ago. The client has resumed work. Pay attention. Participate in social activities and state, I still miss them, but I'm learning how to live again. What do you think? These are 6 patients. You have to know types of grief. Put it together. Write this note down. But I want you to try and select your answer. Look at it again based on the story and pick an answer. Let's look at A. A, what is the problem? 42. Spouse died in an accident. He said, I can't believe this happened. I keep expecting them, they're going to come, but they're not coming. The client discussing what? Avoid discussing the arrangement of funeral because she thinks the doctor must be wrong. This is what we call what? Is he anticipatory grief, normal grief, complicated grief, disenfranchised grief, or delay? She's delaying a grief. She does not want to deal with the grief, so this is delay. The parent of whose child died 10 years ago continued to keep the bedroom unchanged, doesn't touch anything, cry all the time. She said life stop as soon as my child died. It's been 10 years. You have to move on. If you have no move on, this is what we call prolonged grief, complicated grief. A client whose partner is diagnosed with advanced Alzheimer's disease state, I feel like I'm already losing them, even though they are still alive. So she's basically dealing with the grief before anything happened. They're here by already anticipating the grief that will come. This is what we call anticipatory grief. A client recently diagnosed with metastatic cancer reported intense sadness, anger, insomnia. The client states, I'm grieving the life I thought I would have. Therefore, what do you think that she's doing? The client is preventing, she's not showing the grief. She's just basically not acknowledging the grief that will come. That is disenfranchised. When you disenfranchise somebody, you take something away from them. That's what happened. And this last patient, a client sibling, died 6 months ago. It's been 6 months. That's the key. The client has returned to normal. She has grieved for 6 months, returned to normal activity, participating and stating, I still miss them, but I'm living my life. This is what we call normal, uncompleted grief. Write it down. Watch that portion of the video. I want you to know it so that when you see it next time, remember, Adapt NCLEX give you all the concept associated with that, and you don't forget it. This is the key aspect. You can read about it, but this is the only little things I can give you to remember them. Prioritization. We are now on prioritization. Are you ready? Be sharp. If you want to learn more how to do prioritization, check Adapt NCLEX. I have so many videos, and the concept is what? Be sharp. You hear me going to say be sharp, be sharp. And this is what I want to deal with. Is it a breathing issue? I'm worried about it. Electrolyte? I'm worried about it. Is it shock, sepsis? Is it what? Hypothermia, hypoglycemia? Is it airway? Is it like neurological problem? And is it pain? And is with pain, is the pain going to kill you, lose your life? Then that's a priority. This is your prioritization 101. Now, let's get to it. Which of the following findings require immediate follow-up? The next is reviewing laboratory results for assigned client. The way to answer this kind of lab value is you may see expected lab value, but see which one is the worst. Then you go for one by one, you break them down. AST is what? 3 times normal value I've given you in a client with end-stage liver disease. Is that what you should expect? The VBC is 13,000 in a client who has productive cough and arthralgia. Creatinine kinase of 20,000, right? In a client taking statin, and a potassium of 5.0 in a client with chronic kidney disease. Stop the video, pick your answer, let me know. You pick your answer, keep track of it. But I can tell you, one is normal. If you have liver disease, your AST is supposed to increase. Don't worry about it. If you have productive cough and arthralgia, you have infection. Your white count will go up. Don't worry about it. If you take statin and your CK, creatinine kinase is coming from muscle, the muscle is breaking down. Therefore, 20,000 is almost like more than 10 times that what you're supposed to be. That's rhabdomyolysis. Bad problem. Potassium 5.0 expected in the chronic kidney disease. Therefore, what is the right answer? Number 3. Next question. A triage nurse is assessing several clients in the emergency department. Which client should the nurse see first? Who you need to see? 1 second. Client with right flank pain and fever, flank pain and fever. Client with left lower quadrant tenderness, nausea, white count of 15,000. Client with palpable abdominal mass with debris to the left of the umbilicus. A client with epigastric pain radiating to the back and a serum lipase of what? 300. What do you think? Figure out what is going on with each patient and prioritize them. Pick your answer. You pick your answer? Before I give you the answer, I know you pick it. Right flank pain and fever, it may have like UTI or pyelonephritis, right? This can be left lower quadrant tenderness, nausea, white count of 15. This can be diverticulitis, right? Palpable abdominal mass and a bruit. This may be AAA that is about to rupture, abdominal aortic aneurysm. And if you have epigastric pain radiating towards your back and amylase of 300, this is pancreatitis. Who do you think is in trouble? I see a shock patient. This patient is in shock, right? I see diverticulitis, UTI. This is infection. It's not through sepsis. And I see normal pancreatitis. I'm going to pick C because this patient is bleeding and is going to rupture. And this is in the emergency department is assessing several clients. Which client should the nurse see first? Same thing, prioritization. If you use that strategy, you can answer all these questions right. What do you see? The client with painful urination and weak urine stream, dysuria. Client with what? Right front pain radiating to the groin and hematuria. I have suprapubic pain, I have dysuria and a white count of that. And I have white count of 13,000, right front pain and fever. This is urinary pathology. This is kidney nephrology question, but there is a priority because they all sound the same, but they are not. Pick your answer. Let me know. Keep your track. Number 8. Let's figure it out. Painful urination, weak urine stream, and dysuria. This may be BPH. Right front pain radiating to the groin and hematuria. This is kidney stone. And suprapubic pain, dysuria, and white count of 13,000. This is what? Cystitis, bladder infection. You have infection, right front pain, and a fever. This sound more like pyelonephritis. Pyelonephritis is more dangerous than cystitis or kidney stone than BPH. Therefore, we're going to pick this patient. And next is the medical surgical unit is prioritized care. Which client should the nurse see first? A client with cold, clammy skin whose IV has infiltrated. A client with appendicitis whose IV fluid has run out. A client with pneumonia who is due for antibiotic. A client with awaiting discharge instruction. Who do you think you need to see? Pick an answer, let me know. But I can tell you the right answer is A. Cold, clammy skin. It means shock. This guy is in shock. Be sharp, right? Appendicitis, you need IV fluid. We'll give it to you. Pneumonia, you need antibiotic. We got to hurry up and give them to prevent sepsis. You are waiting discharge, you have time. But you have cold, clammy skin, you are in shock. We got to see you. And this is caring for 4 clients on neurological unit, neuro patient. How do you prioritize them? There's a strategy. Ischemic stroke, whose blood pressure is 178/98, recent stroke. I have meningitis who report a severe headache and photophobia. Is that what you expect? A client with head injury who is difficult to arouse and has new onset unequal pupil. A client with Parkinson's disease, he has what? Shuffling gait, requesting assistance to ambulate. What do you think? Prioritization. Pick your answer. Let me know who is in trouble. What do you think? I can tell you the right answer. Somebody with the head injury who is difficult to arouse and has new onset pupillar change. That's what? Herniation, bad problem. If you have stroke, we can allow permissive hypertension. So your blood pressure 178/98 is okay. Sometimes we can let you go up to like 200 the first 2 days, but that is not a priority. Meningitis, you need headache and photophobia, expected finding. And Parkinson's disease patient shuffling gait is a safety question, but this patient headache is bad. He's having difficulty to be aroused and unequal pupil. Changing GCS, we have to see that patient. And this is the emergency department is assessing for pediatric client. Which client should the nurse see first? Prioritization. We are in 11. What is your score right now? Put your score down. 10 questions, adapt English. Like I said, this is a mock exams. English practice question, most commonly tested questions on the English, on topics, prioritization. A child with what? Croak, as what? Backing cough. A mild inspiration stridor when crying. Should you worry about it? A child with cystic fibrosis who has thick mucus and crackles in the lower lobes. Why would you worry about it? Let me know. A child with pertussis who has paroxysmal coughing followed by high-pitched inspiration whoop and facial cyanosis. What do you think? A child with asthma who has expiratory wheezing with the peak flow of 85%. Who do you want to see? Pediatric respiratory prioritization. Let me know. Commonly tested. We are using common sense approach to answer the question. Think about it. What do you know about backing cough? What do you know about cystic fibrosis? What do you know about ptosis? And what do you know about asthma? What should you expect? You pick your answer. I know you get this one, even though it may be slightly trappy. This is your right answer. Why? Ptosis, of course, I expect what? Paroxysmal cough. But what is the problem? High pitch inspiration wheezing, and they having cyanosis. I expect them to what? Have wheezing, and I expect them to have inspiratory whooping cough. But now there's a change, facial cyanosis. That means this is so severe, they're becoming hypoxic. Asthma patient, if you expect you to wheeze, if your peak flow is 85, you're doing great. And cystic fibrosis, you have thick mucosecretion, I'm okay with it. And croup, you have a backing cough, a little bit of inspiratory stridor is expected. Therefore, this patient is in trouble. So ptosis causes severe uncontrolled coughing spell. And then if you have cyanosis, that's a sign of what? Hypoxia. It is 9 o'clock. And the nurse is preparing to give medication. Which client should the nurse see first? Prioritization. Whose medication is more important? If you don't give it to them, they're going to get sick. So patient who has Parkinson is due for what? Carbidopa, levodopa. Can the patient wait? Client with hypertension who is due for lisinopril. Can they wait? A client with type 2 diabetes who has blood glucose of 72. Can they wait for their insulin? A client with hypothyroidism who is due for what? Levothyroxine. Who are you going to see first? This is a trappy one, but it requires some test-taking strategy. What do you think? Pick your answer. Let me know. Pick your answer. Let me know. I can tell you the right answer is that. Why? The patient who has diabetes, his glucose is 72, is due for insulin. You know, if you give them insulin, they're going to become what? Hypoglycemic. So this is the patient you got to go check and make sure what is their glucose and check it and say, hey, no, I'm going to hold your medication because it's inappropriate. Your sugar is too low. So I got to check on you. Hypothyroidism patient can wait for their levothyroxine. Hypertension patient can wait for lisinopril. Parkinson patient can wait for a carbidopa. But these type 2 diabetes, if sugar is low, if you give them their insulin, they're going to become hypoglycemic. But what do you need to do? You need to check on them first and then assess them and see what the glucose is going. You say, I'm not going to give it to you. Therefore, that's the right answer. It's a little bit test-taking strategy. So giving insulin now could cause hypoglycemia, right? Therefore, the client requires immediate reassessment and possible holding the insulin because you can't give it to them. You got to assess them first. Their glucose is 72. It may be going down. So go and check on them and then hold the medication. That's the purpose of this question, to think critically. And then in the emergency department is assessing for clients who report chest pain. Which client should the nurse see first? There may be chest pains that are bad and there's chest pains that are really, really, really bad. Who? A client with crushing substernal chest pain radiating to the left arm, diaphoretic blood pressure is 88/54. A client with sharp chest pain that worsens with inspiration and improves when leaning forward. A client with burning chest discomfort after eating spicy food. A client with what? Localized chest wall tenderness that increases with palpitation. Whose chest pain is the worst? Whose chest pain you need to be concerned about? Whose chest pain is a problem? What do you think? I can tell you, one is having cardiac chest pain. Crossing chest pain, substernal chest pain relating to the arm with diaphoretic hypotension, that's heart attack. Chest pain without worsening with inspiration, improving with leaning forward, pericarditis, you have time. Don't worry. Burning chest discomfort, eating spicy food, that's good. Gastroesophageal reflux. And localized chest wall tenderness that increases with what? Palpitation is costochondritis, bony problem. One is in trouble. And this is caring for 4 clients diagnosed with infective endocarditis. The client should be, which client should the nurse see first, right? Which client? 4 clients. 4 clients diagnosed with infective endocarditis. Which client should the nurse see first? Client with splinter hemorrhage noted on the nail bed. Client with temperature of 101. Client with cold leg foot. And client reporting fatigue and generalized weakness. There's a mnemonic for endocarditis. If you know it, you can write it down, use it to answer this question. That's the test-taking strategy. Don't fall for expected finding. Pay attention to unexpected. What is your answer? But I can tell you, leg foot is bad. That means ischemic of the leg. You should not expect that. But what do you see? Endocarditis, I call it from Jane. You should expect what? Splinter hemorrhages. You should expect fever. You should expect generalized fatigue and weakness due to the anemia. But when you see leg foot, you're going to have what? Ischemic to the leg. And that leg is dying. Therefore, that's what you're going to see. This is endocarditis. So from Jane is F is fever, expected. Road spot is you see emboli in your eyes. Also note the tip of your fingers. You listen to them, you're going to have heart murmur. Genway lesion in their palm. Anemia, chronic disease. Splinter hemorrhage on their nail bed. Emboli, if you go wrong place, especially your leg, you get leg pain. Your lung, you get what? Pulmonary emboli. If you go to your brain, you get stroke. If you go to your abdomen, you get abdominal pain. Those are your priority. And this is assessing the client in outpatient clinic. Which finding I can send is selected apply. Random glucose of 140, toe ulcers, shiny lower leg, skin and lack of air, negative pinprick test, blood pressure of 130/65, cold and pallid skin. What do you see? We move to cardiology. NCLEX cardiology, cardiac nursing, cardiac what? Concept that you need to know. Cardiology. What do you think? If you see in this patient in your clinic and you see all these features, which one should concern you? That's all. Random blood glucose of 140. Is it bad? Toe ulcers. Is it bad? Shiny left leg and lack of air. Is it bad? Negative pinprick test. Is it bad? Blood pressure of 130/65. Should you worry about? The cold and pallid skin. Should you worry about? I can tell you, glucose of 140 is fine. But if you have toe ulcers, peripheral arterial disease. If you have shiny lower leg and lack of air, peripheral arterial disease. If you have negative pinprick test, it's also peripheral arterial disease. If I do a pinprick, you can feel it. That means you have neuropathy. Your blood pressure of 130/65 is okay. But a cold, pallid skin, peripheral arterial disease, all these are bad. And then it's reviewing an EKG strip which shows what? Regular rhythm, rate of 160, and a Y complex what? QRS, and there is no P wave. Which rhythm should the nurse identify? A flutter, ventricular tachycardia, supraventricular tachycardia, and sinus tachycardia. There's a way you can answer this question and you can never be trapped. So pay attention. So which one? And then it's reviewing an EKG that shows a rhythm. The rate of 160, there's a wide, bigger QRS, but there's no P wave. What do you think? Pick your answer, let me know, and I'll break it down for you. Sometimes they will give you questions like that with EKG, without the EKG. This is a recommendation from a student who took the exam, said this is what they saw, something like that. What do you think? What would you pick? This is straightforward. If you have no P wave, that means it's no atrial problem. Therefore, atrial flutter is gone. Supraventricular tachycardia, all of them as P wave. The only thing that does not have P wave is QRS. Another thing you can look at is wild QRS complex. Atrial fibrillation, the QRS is not wide. Supraventricular tachycardia, QRS is not wide. Sinus tachycardia is not. So this is ventricular tachycardia. And this is assessing an unresponsive baby is non-responsive, 10-month-old infant, and no breathing. If you're not breathing, what do? Which pulse site should the nurse assess? Where do you check a newborn, 10-month-old? Where do you check their pulse if you have to do CPR? Cardiac pulse, radial pulse, femoral pulse, brachial pulse. Where do you check a newborn, 10-month-old, less than a year? Where do you check their pulse when you're doing CPR? It's not cardiac. It's not the best one. Radial, you can feel it. Femoral, you can. Brachial is the best one. And this is planning care for a client with symptomatic aortic stenosis. That means the aortic has stenosis. Blood flow will be a problem. Which intervention should the nurse include in a plan of care? Select apply. Monitor for exertional chest pain. Encourage vigorous ambulation. Maintain adequate preload. Monitor for syncope. Administer diuretic aggressively. Prepare the client for possible valve replacement. What do you think? Aortic stenosis is the outflow problem. If blood is not coming out, patient is going to have certain symptoms. This is valvular heart disease question. If you don't even have an idea, think about it. The aortic stenosis, I'm trying to guide you. This is the aorta. This is your heart, and this is the ventricle. Ventricle is here. It pumps blood to the aorta, and that's where it goes to the rest of the body. If this is obstructed, what do you think is going to happen? Sometimes that's what you're going to do. I'm a visual guy. I try to draw it so that I can see what is going on. Therefore, how would you answer this question? If you exert yourself, you're going to have exertional chest pain because less blood is going. That's number one. Vigorous exercise. If this is going to cause pain, vigorous ambulation is exertional. Therefore, you should not do that. Maintain adequate preload. That means we should have enough blood here so that when we push, enough can come out. That's good. We have to monitor for what? Syncope. You patch that because there's less blood flow out. If you give them diuretic, it's going to decrease their preload. They're going to have syncope. They may need possible valve replacement because severe aortic stenosis can lead to cardiac arrest. Therefore, these are very important answer choice. You have to think about it. You don't have to even memorize it. And this is assessing for client in the cardiology, taking nitroglycerin for stable angina. Which client need additional instruction? This pharmacology question, you should know cardiology on nitroglycerin. Know how to teach the patient which teaching is appropriate. A 65-year-old sits down and take a tablet at the first sign of chest pain. Is it okay to do that? A 58-year-old who placed the tablet under the tongue every 5 minutes up to 3 doses as needed. A 70-year-old who swallowed the tablet with water when chest pain happened. Should you question that? A 60-year-old who keep the tablet in the original dark glass container. These are concepts associated with nitroglycerin that you got to teach the patient. Risk reduction, NCLEX practice question. Take your answer, let me know. But I can tell you, it's sublingual. You should not put it anywhere except your tongue. You should take it by sitting down because it can cause orthostatic hypotension. You are allowed to take 3 times every 5 minutes while you're waiting for the emergency room people, and you keep it in the original container. What is the next priority teaching for a client on what? Taking bumetanide. First, recognize the medication and figure out what it is. Like I said, cardiology, I'm going through every area of cardiology. They will ask you. It looks like pharmacology, but that's not pharmacology question. This is prioritization pharmacology. Therefore, this is cardiology. Avoid sunlight, increase fluid intake at night, change position slightly and slowly, take on empty stomach. I take bumetanide. What should I do? Teaching is appropriate. He said, what? Loop diuretic. We call dehydration. Orthostatic hypotension is more important than photosensitivity. And therefore, change position slightly is very important. And then she's preparing a client for discharge who has been prescribed enalapril, ACE inhibitor. Which teaching point should the nurse include? Select or apply. What do you think? Which teaching point should you apply? Now we're on pharmacology. Which teaching point will you apply? Rise slowly from sitting to laying position. Add fish, avocado, strawberry, tomato to your diet. Take the medication with food to reduce stomach upset. Check your pulse 1 full minute before the medication. Expect increased urine output when starting the medication. What do you think? What do you think? You didn't have to rise slowly from a sitting position, right? Why do they add fish, avocado, strawberry, and tomato to your diet? This will increase your potassium. ACE inhibitor will increase your potassium. Avoid that. Take the medication with food to reduce stomach upset. You don't have to, you can take it with food or without food. It's not a teaching. Check your pulse 1 full minute before the medication. You don't need to check your pulse 1 full minute. It's not what? It's not the Jackson. Expect increased urination when starting the medication. It's not what? Loop diuretic or thiazide. Therefore, it does not affect. There's only one question, one answer choice then. But this is test taking strategy. You can see only one answer in NanoPro. NS scale for a client with infective endocarditis. Which assessment finding is concerning? This was the similar one that we gave, and it's based on the same concept. Splinter hemorrhage, temperature, leg pain, retinal hemorrhage. You know retinal hemorrhage is suspected. You know temperature is suspected. You know splinter hemorrhage is suspected. Leg pain is the similar one we saw, but asked in a different way. And this is taking what? Atorvastatin is being assessed, which finding require immediate reporting. Which one? Muscle pain, clear urine, elevated creatinine kinase, fatigue, and a peak T wave on the cardiac monitor. What is atorvastatin? It's a statin. If you take a statin, what side effects should you teach the patient? What do you think? Pick your answer, let me know, and keep your score. Muscle pain is bad. Clear urine, you don't have rhabdo. Elevated creatinine kinase is rhabdomyolysis. Fatigue is an expected finding. If you have rhabdomyolysis and the cell die, you release potassium. You have peak T wave. Those are your answer. What is your score so far? We are about to E25, and I want to see where you are. A client with recent pericardial effusion is being assessed for what? Cardiac tamponade. What do you know about cardiac tamponade? Which finding would the nurse suspect? Select or apply. Now pulse pressure, muffled heart sound, JVD, hypertension, bradycardia. You can see most of these questions are select or apply, SATA questions for these ones. You can see, unlike SATA cardiology, so that you can put it together and use the concept. What does that mean to have cardiac tamponade, and what is an expected finding? Stop the video, pick your answer, and then let's break down the concept. You pick yours. This is your heart, surrounded by fluid. It's going to squish your heart. If it does, what is going to happen? Your blood pressure or your heart rate, sound from your heart will go down. You have muffled heart sound. You have heart failure from blood backing up. You get a JVD. Your heart cannot pump. Your blood pressure goes down, not go up. You try to increase your output by causing tachycardia. And your blood pressure, systolic and diastolic, get closer to each other. You get narrow pulse pressure. That's how you answer this question, specifically related to that. Therefore, narrow pulse pressure, muffled heart sound, and JVD is classic for cardiac tamponade. 25. And this is assessing a client who was admitted 2 days ago with pericarditis. The nurse notes several changes during the assessment, which finding require immediate follow-up. Select or apply. Blood pressure of 88 over 92, 52. Client report chest pain that improved when sitting upright. Neck vein distension noted while the client is at 45 degrees. Heart sound faint on auscultation. Temperature 101.8. Pericardial friction rub head on the left sternal border. This is a hard cardiology question, but it's not. It's a concept. Like I said, write down the concept. Use the concept. Break the question down. You can answer it. I believe in you. I want you to get this right. Number 25. Put down your answer in the comment section. Let me know how you approach this question. But you already know it. It depends on how you approach it. You pick your answer. Pick your answer. Let me know. Now, let me break it down. I can tell you what are the answers. Pericarditis. If you have pericarditis and it's severe, the priority for pericarditis is look for signs and symptoms of cardiac tamponade, because it can squeeze on your heart and your heart become, you develop cardiac tamponade. We call it constrictive pericarditis, leading to cardiac tamponade. Based on the previous question we saw, same thing. Hypotension, it means your heart is going to be having cardiac tamponade. If you have chest pain that improves leaning forward, that's consistent with your pericarditis. Don't worry about it. If you have neck vein distension at 45 degrees, that's JVD. What? Cardiac tamponade. If your heart sounds are faint, is what? Muffled heart sound. If your temperature is 100.8, is consistent with pericarditis. If you have friction rub that is head on the left sternal border, pericarditis. We worry about what? Cardiac tamponade. Therefore, this is cardiac tamponade, this and that. ACD, cardiac tamponade. 25. What are your score? You're finishing cardiology, and nurse is assessing a client who was admitted 2 days ago with what? Addison disease. You see, we moved to endocrine concept. Endocrine is part of risk reduction. Therefore, let's see how much you know endocrine. I want you to score high on this portion, because these are endocrine questions. It's a strategy you can use to answer, which finding require immediate intervention. 2 days with Addison, blood pressure of 82/48, serum potassium of 6.2, sodium of 130, patient has fatigue, and a glucose of 58. Which finding require immediate intervention? Admitted with what? Addison disease. Pick your answer. Let me know which condition should bother you. What do you think? If you have Addison and you have hypertension, you are in crisis. If you have Addison and your potassium is high, you are in crisis. You see what I'm doing? Your sodium is what? What is your sodium going to be? Going to go down. It's going to 130. We have a problem. In fatigue, signs of what? Crisis. Glucose is low, signs of crisis. All these signs are consistent with Addison disease being in crisis. And this is assessing a client with new diagnosis of Addison disease. Which findings are consistent with Addison disease? Selected apply. Hyperpigmentation, hypotension, weight gain, hyponatremia, hypokalemia. Think about it. Stop the video. Pick your answer. Let me know. And let me see if you get this one right. Put down in the comment section, and it said 27. This is what I selected. In Addison, you don't have all the steroid, corticosteroid. You don't have aldosterone. It's not there. You don't have epinephrine. It's not there. Therefore, your sodium is going to go low, but your potassium is going to go up. You're going to lose weight because you have no sodium. Your blood pressure is going to be low, and you have hyperpigmentation. So ABE are your right answer. These are strategy you should expect in a patient with what? Addison disease. So hyperpigmentation, hypotension, and what? Hyponatremia. They're going to have hyperkalemia and a weight loss in this situation. And this is assessing a client with what? Hypothyroidism. I say most endocrine question, you have to know signs and symptoms. So that's what this is based on. And it's a selected apply to test your knowledge. So this is SATA endocrine questions. If you have hypothyroidism, should your temperature goes up or low? Should your heart rate goes up or low? Should you have constipation or diarrhea? Should you have slow speech or speech faster? Or should you have lethargic or be awake? Which of this is consistent with hypothyroidism, and which one require immediate follow-up? Patient has hypothyroidism. What do you expect? And which signs tell you they're doing bad? Hypothyroidism, temperature of 95, bad problem. Heart rate, bad problem. It's in patients in coma. Constipation, I don't care about it. Slow speech, bad problem. If you are lethargic, bad problem. These are all really, 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 really bad. And so those are the ones I have to worry about. But which one require immediate follow-up? That. Constipation is not the problem. Low temperature, low heart rate, slow speech, and lethargy. That patient is in trouble. And this is caring for a client recently diagnosed with what? Hypothyroidism. The nurse reviewed the client assessment data, which findings are consistent with this diagnosis. When you have hypothyroidism, what do you expect? Same idea. We again cold intolerance, bradycardia, heat intolerance, and dry skin. Pick your answer, let me know. But endocrine questions, it can be like that. You have to do a bunch of selected apply. That's the only way you can. But I can tell you the way to know what are the signs and symptoms of hypothyroidism is to think about it. Everything is going to go what? Down, except what? Except your weight. So your weight goes up, they have weight gain. But everything goes down. Cold intolerance. They have bradycardia. They don't have heat intolerance, and they have dry skin. That's what you see in this patient. And this is assessing a client with hyperparathyroidism. Pay attention. This can be a trap. Look at the word hyper. It's not thyroid problem. You see, there's hyper, but there's para. The para make this calcium. This is calcium metabolism, which finding require immediate follow-up. Selected apply. Calcium 1, calcium 13.8, muscle weakness, short in QT, constipation, and lethargy. Which one is concerning and which one require immediate follow-up? What do you think? Hyperparathyroidism, calcium is high, but this is too high. 13.8, we got to figure out something is going on with the patient. It's too high. Muscle weakness, sure. Expected finding. Short in QT is too much. You're going to cardiac manifestation of the problem. Constipation, expected finding. And lethargy, what do you think? Bad problem. That one, we got to intervene. Next is assessing a client with what? Syndrome of inappropriate antidiuretic hormone secretion. Which finding require immediate follow-up? Select or apply. Which one require follow-up? Sodium of 118, headache, confusion, urine-specific gravity of 1.032, and seizure activity. Which one would you have to do something? This one is straightforward, right? SIADH. What does it cause? Hyponatremia. If your sodium is low, you have seizures. This sodium is what is going to cause seizures. And I have confusion here, A. And if you have headache, it's showing that you are fluid overloaded. I'm worried about it. Your urine-specific gravity is going to go up. I don't worry too much. It does not require immediate follow-up, and therefore, those are the ones I would pick. The LALA value is manifesting as low sodium. You're getting headache, you're getting confused, and you have seizures. I'm worried about it. And this is caring for a client who was recently diagnosed with SIADH. Which finding should the nurse expect on assessment? Is based on the same question. What do you expect? Hyponatremia, low serum osmolarity, concentrated urine, polyuria, and weight gain. What do you think? These are things that you have to apply a little bit of critical thinking and say, oh, what is the problem with SIADH and what should I expect? And then pick your answer. You pick yours. What is the problem with SIADH? Too much ADH. That means you're going to hold on to too much water. Your sodium become low. Your serum osmolarity will follow. Your urine get concentrated. You're not going to pee. Urine output will decrease and you're going to gain weight. If you apply the concept, you see the answer choice, I call it, they will pop out like a candy. So this is the way you answer it. The same thing, as you can see, all the endocrine, I just want you to know the signs and symptoms so that you can use it to apply questions. And this is assessing a client with Cushing. Which one require follow-up? Select or apply. Glucose of 420, blood pressure of that, moon phase, potassium low, purple striae. Which one require some intervention? Pick your answer, let me know. But I know you will pick sodium, glucose is too high. That's no brainer, right? I know you're going to pick hypertension. We get into urgency state. I know you're not going to pick moon phase, expected finding. And I know you're going to pick potassium of that because purple striae is expected. And this is assessing a client with what? Primary hyperaldosteronism. That means it's an aldosterone problem. What does aldosterone secrete? Aldosterone. What is the effect of aldosterone? Hypertension. What is the name of this primary aldosteronism? It's a Crohn's disease. Same thing. Which finding require follow-up? Bad stuff. Potassium 2.8, blood pressure 170/100, muscle cramp, metabolic acidosis, and sodium of 142. What do you think? If you have too much aldosterone, what do you think? Pick your answer, let me know. But I can tell you, if you have too much of aldosterone, your sodium is supposed to be high. 142 is good. The potassium is 2.9, 2.8 is bad. We should do something about it. A blood pressure of 170, even though it's getting to an expected range, it's still high. We should require some follow-up. A muscle cramp, what do you think? Is due to what? Low potassium. That's why you have muscle cramp, signs and symptoms like that. Metabolic acidosis, and this is an expected finding. So we're not going to worry about it. What is your score? NS attend the staff education program of parathyroid disease, which finding the nurse should recognize as being consistent with what? Hyperparathyroidism. Think about it. I'm going to lead you. Hyperparathyroidism means you have parathyroid problem. Hyper means too much. Parathyroid will lead to calcium. Therefore, if your calcium is high, your symptoms is going to go down. What do you expect in hyperparathyroidism? That's what you expect based on that concept. So high calcium, what should you see? Things go down. So pick things that are going down. If you're going up, don't pick it. That's my concept for you when you see parathyroid problem. Kidney stone is going down. Bone pain, I'm going down. Depression, I'm going down. Tetany, I'm going up. Constipation, I'm going down. Leg paresthesia, I'm going up. I'm not going to pick it. That's how you pick these kind of calcium questions. NS is teaching a client prescribed metronidazole for gastrointestinal infection, which statement by the client indicate a need for further teaching. To avoid drinking alcohol while taking this medication. I may experience a metallic taste in my mouth. It's safe to take this medication with alcohol in small amount. I should complete the full course of the medication even if I feel better. It's safe to take this medication with alcohol in small amount. I should complete the full course of the medication even if I feel better. What do you think? What do you think specifically for this medication, metronidazole? What are you worried about? It's teaching you got to provide for the patient, and this is based on that question. You pick your answer. I can tell you this is what? Very important information you should let the patient know. They should avoid no alcohol. They should not take any more alcohol. So if I can avoid drinking alcohol while taking this medication, it's not safe to take small amount of alcohol. You're going to have metallic taste in your mouth, and you should complete the full course of the antibiotic. NS is preparing to administer an enema to a client. Which action should the nurse take first to ensure patient safety? Warm the enema solution to body temperature. Position the client in the left lateral position. Assess the client for history of what? Recent rectal surgery. Instruct the client to retain the enema for 50 minutes. It's prioritization. Which one is safe? It's better to know if the patient had rectal surgery before you put the enema there. The rest are all expected, but this is a priority. If they have rectal surgery, no enema. And next is review laboratory results for a client diagnosed with what? Liver disease. Which of the following findings should the next suspect? AST, ALT, albumin, prothrombin time, total bilirubin, and blood ammonia level. What should you expect? Which direction should you go? AST, what do you think? ALT, what do you think? All of them, which direction should they go? AST is supposed to increase. ALT will increase. Albumin is supposed to decrease. Prothrombin time will increase. Total bilirubin will increase. And blood ammonium will decrease. This is the lab values you should expect when you're dealing with a patient with what? Cirrhosis or end-stage liver disease. Which instructions should the nurse include to help a client prevent damping syndrome? When you do gastric surgery, the major risks associated with this is damping syndrome. That means fluid go down and get into the GI tract quickly. What teaching would you provide to prevent damping syndrome? Eat small, frequent meal. Lay down after the meal. Drink fluid with meal. Increase intake of simple sugar. Consume high protein and moderate fat diet. As usual, stop the video, pick your answer, and let me know. But if this is your normal stomach, usually gastric bypass, you have like that. And then we have this connected to that. Every time you eat, it comes straight like that. Therefore, what we teach the patient is to do what? Eat small, frequent meal at a time. That's appropriate. You should lay down after you eat. 30 minutes is good. You should not drink with your meal. You should increase simple sugar, no, complex, and consume high protein. This is why these people eat protein shake, because it prevents damping syndrome. And this is assessing a client with acute appendicitis. Which finding are expected in a client with appendicitis? What do you think? Appendicitis is usually an acute GI problem. Do you have periumbilical pain radiated to the right lower quadrant? Do you have relief of your pain with movement? Do you have high fever? Do you have palpable mass at the right lower quadrant? Do you have Murphy sign during right upper quadrant palpation? Stop the video, pick your answer, let me know. But I can tell you, appendicitis is consistent with what? Right lower quadrant pain. There is no relief of your pain, no matter what you do. You don't have high fever, you have low-grade fever. You're going to have palpable mass at the right lower quadrant only if you have perforation. So this is not expected. And Murphy sign is associated with what? Cholecystitis. Therefore, only one answer choice. Over-select, you lose point. Only one. And this is caring for a client with acute pancreatitis. Which of the following findings should the nurse suspect? And as you can see, all these videos based on, I want you to know your content. If you know your content, expected finding. This will help with prioritization. Pancreatitis. Do you have tearing chest pain radiating to your back? Do you have elevated amylase and lipase? Do you have abdominal distension and tenderness? Do you have pain relieved by leaning supine? And do you have nausea and vomit? Pancreatitis. Pick your answer. Pancreatitis, major signs and symptoms is what? Pain radiating towards the back, not your chest. It's not your chest. Therefore, that's a trap. Your amylase and lipase is going to go up. You're going to have abdominal distension. The pain, it gets worse when you are in the supine position. So you got to be in the fetal position. That is the thing. Write that one down. And you have nausea and vomiting as the main thing. And next is assessing a client with ulcerative colitis. Which statement indicate a lack of coping? If you know coping, that means you know adjusting to the condition. I feel like I can manage my diet and medication just fine. I'm afraid to leave the house because I might have an accident, diarrhea. I get frustrated and cry whenever I have diarrhea. I try to plan my day around my symptoms. I don't eat any food that causes a lot of gas. Which signs indicate coping with the disease? If you can manage your diet and medication, you're good. If you don't want to go out because you're afraid of having diarrhea, that's a problem. You are not coping. If you get frustrated because you have diarrhea, you are not coping. I will try to plan my day around my symptoms. Yes. What do you think? It's very adjustable to know that this is what is going to happen. So you plan your day around it. And I don't eat anything that can worsen my situation. So those are all coping skills. The client has been diagnosed with celiac disease. GI, like I said, I'll give you all the content associated with GI. Which potential complications should the nurse include in the plan of care? What is celiac? Gluten issue. You eat, you get sick. Therefore, iron deficiency, osteoporosis, B12, weight loss, type 1 diabetes, dermatitis, lymphoma. Which of these are associated with celiac disease? If you get this wrong, I want you to spend time on Adapting classes. Videos on celiac will give you all the signs and symptoms and key things you should know about. You pick your answer, stop the video, pick your answer. But due to more absorption, you're going to have iron deficiency anemia. You're going to lack calcium, you're going to have osteoporosis. B12 is not associated with that because it has nothing to do with the terminal ileum. You're going to have weight loss and malnutrition. There's no diabetes associated with it, but you can have skin manifestation, dermatitis, and the chronic inflammation will lead to lymphoma. And this is assessing an adult infant who has been vomiting for 3 days and diagnosed with what? Pyloric stenosis. Which of the following findings should the nurse expect in pyloric stenosis? Olive-shaped mass in the right upper quadrant. Projectile vomiting after feeding. Saccine fontanelle, metabolic acidosis, weight loss, and decreased urine specific gravity. When you see this question on pyloric stenosis, think about dehydration question, because this is the pylorics. It's here. Fluid is going to come out. They're going to vomit. So excessive vomit, it leads to dehydration. So every answer choice, think about it about dehydration. So what do you pick? Olive-shaped mass, they're supposed to have mass, so that's consistent. But they're going to have projectile vomiting. If you vomit, your fontanelle will send. Since you're losing acid, you get metabolic acidosis. You're going to lose weight due to dehydration. And your urine specific gravity is supposed to increase because of the dehydration. So I'm using the concept to answer the question. I want you to do that. A client who follow lacto-ovo vegetarian diet is selecting lunch. Which meal choice is appropriate? Grilled chicken sandwich with cheese and milk. Tofu stir fry with vegetables and a glass of milk. Egg salad sandwich with bacon and yogurt. Tuna salad with boiled egg and cottage cheese. This is diet question. What kind of diet? It's a vegetarian and it's a what? Lacto-ovo. That means they can eat milk and egg. That's all. Therefore, what is your answer? I guide you. What is your answer? Chicken is not milk and egg. Stir fry with vegetables with milk. That sounds okay. Egg salad with bacon is not milk or over. Tuna salad is not milk or over. Therefore, this is good. Now, we're on pharmacology. What do you think? A nurse care for several clients on anticoagulation. Which client statement indicate the need for further teaching? Select or reply. Warfarin, I will need weekly blood draw. Enoxaparin, I will need weekly lab blood draw. Rivaroxaban, I will increase intake of vitamin K rich diet. Dabigatran, I will use electric shaver instead of razor blade. Warfarin, I will limit intake of vitamin K diet. What do you think if you're teaching a patient on anticoagulation, what should they do? Pick your answer, let me know. Warfarin, you need what? Blood draw. He said you need further teaching. We don't need to worry about it. On Aspirin, you don't need blood draw. You need further teaching. Rivaroxaban, you don't need to increase your diet rich in vitamin K. Dabigatran, you can use what? Electric shaver instead of razor blade. So that's good. Warfarin, you don't need to limit your intake of vitamin K. Watch for this. Take a picture of this. Read this concept because you may see it somewhere. A client taking heparin develop what? Platelets of what? 40,000. What is the next priority action? Your platelet is low. If you take heparin, you have heparin-induced thrombocytopenia. Continue the heparin and lower dose. Stop the heparin infusion. Assess the GCS and increase IV fluid. If your platelet is low because you're taking heparin, you should stop it. This is no brainer. And this is assessing a client on fluphenazine. You have to know what medication this is. Which finding indicates serious adverse effect of that? Muscle rigidity, urinary retention, hyperparathyroidism, autonomic instability, and dry mouth. First, recognize the medication. If you recognize it, you know what is the main function of it and what you need to do. You pick your answer, it's a selected apply. Fluphenazine is what? First generation antipsychotic. If I see muscle rigidity, it's NMS. Urinary retention is anticholinergic. It's not a problem. Your temperature is high. I'm worried. Neuroleptic malignant syndrome. Autonomic instability, neuroleptic malignant syndrome. Dry mouth is an expected finding. Which instructions should the nurse include when teaching a patient with polyethylene glycol? That is what? Bowel prep. We use this for colonoscopy. Use daily long term. Expect immediate results. Mix it with 4 to 8 ounces of water. Take it with stimulant laxative. It's a laxative for bowel prep. What do you think? You're going to get dehydration. If you're going to get dehydration, drink a bunch of water. No brainer, right? And this is caring for a client taking lisinopril. Which finding require intervention? ACE inhibitor. What should you worry about? Blood pressure of 108/64. Dry persistent cough. Itchy lips and tongue. Allergy to avocado. Angioedema. Number 1. Therefore, this is the right answer. Dry persistent cough. Expected. Blood pressure is doing what it's supposed to do. Allergy to avocado is unrelated. A client taking azithromycin should be monitored for what adverse effect? Hyperkalemia, metabolic acidosis, bradycardia, and hypoglycemia. This is what? A diuretic. Now you can use it if you have what? Glaucoma and other things. But the specific side effect associated, if you don't know, write it down. But choose your best answer choice based on the options I've given you. Most diuretic does not cause hyperkalemia except potassium sparing one. It causes metabolic acidosis. It does not cause bradycardia or hypoglycemia. And this is reviewing prescription for a client prescribed Glyburide. That means medication for diabetes. It's oral medication. It's a sulfur drug, which finding should cause the nurse to question the prescription. Select or apply. For type 1 diabetes, what? Allergic to sulfur medication. Client takes metformin. Client last meal is 4 hours ago. Client severely impaired liver function. Client report episode of hypoglycemia at home. Which of this is contraindicated in the patient who take Glyburide, oral diabetic medication? Pick your answer, let me know. But it's not used for type 1. If you have allergic to sulfur, we should stop it. You can, client takes metformin, you can take both without they do something different. If you last meal was 4 hours ago, it can cause hypoglycemia. It's cleared by the liver, so it's a problem. And if you have hypoglycemia, it causes hypoglycemia, we worry about you. NS is preparing to administer digoxin to a client with CHF. Which finding required the nurse to hold the medication? Which one? Blood pressure 110/72, heart rate of 56, potassium 4, no weight gain overnight. That means it's no fluid overload. What do you think will cause digoxin toxicity? Anything less than 60 is a problem. Potassium is not that bad. So by your apical pulse, this is problem. And this is caring for a client prescribes simvastatin. Which finding is the priority to report? Statin. Number one problem is what? Dizziness, headache, leg pain, and what? Lightheadedness. What do you think? Muscle issue, leg pain associated with it. Leg cramps, it causes what? Rhabdomyolysis. You should worry about it. What is the priority action for a client immediately after transfer to the PACU following surgery? We've moved. You can see it's no more GI. This is fundamentals with perioperative care. Transfer to the PACU, what should you prioritize? Monitor the surgical site for bleeding. Is that a priority? Assess the airway for patency. Review the client's surgical record for complication. Monitor pain medication. What will you do as a nurse if the patient showed up? What will you prioritize? Airway is much better than what? Surgical incision for bleeding. You will die if your airway is not patent. The medical record, you don't care. You want to make sure patient is alive. Therefore, I care about it. Pain will not be the first thing I will check. Perioperative client report eating breakfast despite being instructed to fast. So never fast for surgery. What is the next best action? Who are you going to report to? The doctor. Immediately instruct the client to drink water to clear the stomach. Give them water, clear your stomach because you eat. Inform the operating room nurse about the meal. Is the one going to do the surgery, the operating room? Reassure the client that the surgery will proceed as planned. How do you know? This one, straightforward. You got to let the surgeon know. And this is assessing a client at the perioperative clinic. Which medication prescribed for perioperative client should the nurse question? Surgery, bleeding. Therefore, warfarin, acetazolamide, or Nitro, PPI. Which one you should question? PPI, what do you think? Stop the video, pick your answer, let me know. But PPI is for reflux, or Nitro for nausea, antibiotic for the surgery, warfarin, you bleeding. Perioperative client is restless, bad problem. Tachycardia, are they having airway issue? Blood pressure of 80. All these combinations should tell you bad things is happening. What action would you take first? Call the provider, administer IV fluid, assess the surgical site for bleeding, obtain a start hemoglobin and hematocrit. What would you think? Hypotensive, tachycardia, and restlessness. That's shock. What are you going to do? If you call a provider, it's okay. They will come in, but we don't know what is going on. If you give them fluid, you're treating the problem you don't know. If you assess the surgical site infection, you say site for bleeding, say, oh, it's bleeding. If we don't know that it's bleeding from outside, we know it's bleeding from inside. Getting start hemoglobin, you want to know if it's bleeding, but you can check if this incision is all saturated. If it's not, the patient is bleeding inside before you let the doctor know to provide them with adequate information that you assess and the surgical site infection, surgical site has some blood on it. Which statement by the client scheduled for surgery indicate the need for further teaching about informed consent? That means they don't know about informed consent. Fundamentals are great. And this is where the NCLEX will try to test your knowledge. I can still refuse the surgery even if I sign the consent. The nurse will explain the risks of the surgery to me. I must sign the consent form before I receive sedation. The surgeon is responsible for answering any questions about the procedure. Require further teaching. What is your answer? Of course, you can refuse anytime you want, even if you sign the consent. But the nurse cannot explain the risks of the surgery. The doctor will do that and will be responsible for the detail of the procedure. And you have to sign consent before you get sedation. A postoperative client reports severe pain unrelieved by opiate. Well, you give them pain medication, it's not relief. What would you want to do? The incision is swollen, red, and warm. What is the next priority? Administer higher dose of the opiate as prescribed. Assess the client vital signs and wound site further. Notify the healthcare provider of potential infection. Apply ice packs to the site infection. The thing is pain. It's not helping. What would you do? And you see that they said there's swollen red worm incision. I got to check the vitals, whether there's evidence of infection, whether there is evidence of pain issue before you do anything. So further assessment is required. And next is teaching a client about deep breathing exercise during surgery. Which statement indicate they understand what the instruction? I will hold my breath for 30 seconds before exhaling. I will exhale forcefully through my mouth to clear my lung. I should use incentive spirometer 10 times every hour while awake. I will avoid using incentive spirometer if I feel short of breath. Test taking strategy. There's two things talking about incentive spirometer. That tell you those where the answer choice will be. I'll forget about A or B, even though they will be saying it. But test strategy, A or B, B and C are using incentive spirometer. This one is much better. This is how you answer questions. A client with the history of shellfish allergy is scheduled for CT scan with IV contra. What should the nurse do? Is shellfish contraindicated? Cancel the test due to the shellfish. Confirm the patient has not had any prior reaction to contrast. Administer pre-procedure steroid to prevent an allergy reaction. Ensure the contrast solution is iodine-free. What is the priority? I can tell you B is the right answer because this is a trap. Even though we mentioned shellfish, it's not needed. I don't care if you have shellfish, but they're still going to get what? Contrast. So assess for contrast allergy. That's more a priority than canceling the test. You can't do that. You have no authority. Administer pre-steroid. We don't know if they are allergic to what? Contrast. The shellfish allergy, we don't care. Which of the following client has higher risk for experiencing family or community violence? That means they're more at risk of abuse. 60-year-old retired, okay, live independently in assisted living. 30-year-old pregnant female with the first child. 5-year-old with ADHD. 19-year-old female whose boss is restricted and authoritative. Who is likely more to be abused? 60-year-old is retired by living in assisted living, so there's people around. Pregnant patient is alone with the first child, right? Female pregnant with the first child, more likely to be abused. ADHD patient, no. And just because your boss is strict and authoritative doesn't mean you're going to get abused. It's just a strategy to trap you to pick that answer choice. But what do you care about? Violence is more common in women, children, and elderly. A pregnant lady, a child with mental health, or a kid who is less than 3 years old are more likely. And then the patient who have chronic disease. So these are conditions that can do that. And then scale for a client with a new tracheostomy placed 48 hours. During assessment, the client was accidentally decannulated. What action should the nurse take first? Call the healthcare provider, insert a new tracheostomy tube using the same size, cover the stomach with sterile occlusive dressing, and ventilate via bag mask or administer supplementary oxygen. There's a concept here. If a newly placed tracheostomy comes out, what is your action? That's what the question is asking you. Forget about the 4 answers and think about the concept you know. If it's less than 7 days, what do you do? If it's more than 7 days, what do you do? It's less than 7 days. You should not put it back. You should just cover it and give them oxygen. Therefore, cover and bag mask them. 5 more questions. Number 66. This is a neurology. We move to neuro. Couple of neuro questions. A client with T4 cord injury complain of severe headache, flaw skin above the injury, and a blood pressure of that. What do you think? What is the next first action? Lower the head of the bed, administer hydralazine, check for noxious stimuli such as full bladder, notify the healthcare provider. Think about what is going on. Analyze the question. What is the problem? T4 spinal fracture, severe headache, flush face, and then blood pressure. Is autonomic dysreflexia. What do you do? That's all. Find what is causing the problem. Stimuli, bladder, rectum, remove restrictive clothing. You raise the head up. Then you let the doctor know. If they don't get better, advocacy. But what? First action is what you do. Which of the following client is highest risk of developing autonomic dysreflexia? 25-year-old spinal cord injury at C5. 40-year-old spinal cord injury at T10. 30-year-old with recent stroke, GBS patient. What is your priority? And which one is highest? The question says spinal cord injury, autonomic dysreflexia, anything above T6. Which one is above T6? T5. And this is assessing a client with new onset ischemic stroke. Which finding the next you expect? If you have stroke, we allow permissive hypertension. That's all. Therefore, which one should you expect? This blood pressure is too low. You're going to have more stroke. This is also normal, more stroke. This is better, and this is the best. And this is as caring for a client diagnosed with Broca aphasia after stroke. Which of the following the next you know is consistent with the disease? Select or apply. Expressive aphasia, stroke in the frontal lobe, client speech limited to short sentence and phrases, client prefer yes or no answers, client confabulate, client is unable to understand speech or make up words. There's two types of stroke associated with aphasia that you're supposed to know. Broca and Wernicke aphasia. How do you know? Which way should you go? Pick your answer, let me know, and I'll give you the mnemonic. And don't forget this mnemonic because it's very important. They will help you greatly when it comes to knowing aphasia, right? So this is the way I call it. This is the way I master it. If you Broca, is expressive aphasia is on the frontal lobe. It's Wernicke, is receptive aphasia is on temporal lobe. So this is what? Broca. Therefore, we're supposed to see expressive aphasia. Number one, gone. And it's what? Frontal lobe. Number two, gone. You see, we're knocking them down. You don't have to select everything. If you expressive problem, that means you can't express yourself. Client speech limited to short sentence. You can't express yourself. And therefore, since you can't express, you say yes or no. You cannot talk, so you cannot make a lot of sentence. And you client is unable, you understand, but speech is your problem. So A, B, C, D is your right answer. Know the difference, know the strategy I give you to be able to answer the question. Very important. And as I started, parent of a school-age child about new diagnosis of absence seizure. What you see on absence seizure? Which statement by the parent indicate a client understanding of the correct understanding of the teaching? My child will daydream during seizure. My child will fall down during seizure. My child will experience warning sign before seizure, that is oral. My child will lose consciousness after seizure. What do you think? Absence seizure, there's a name for it. Absence seizure is a stare. You stare, you stare, you stare. You don't fall, you blink, and you daydream. Excellent. That's all. You don't have loss of consciousness. You don't fall down, nothing. And this is working with the client who fell on the ground and appear to be having tonic-clonic. I said this is neurology. If you have problem with the neurology, neuro, check and adapting class. Which of the following action by the nurse is a priority? NCLEX practice question, NCLEX questions and answers, NCLEX review questions, 85 of them. We're using this as a mock exams, and we're on neuro, the hardest portion of the test. Patients having tonic-clonic seizures. What will you do? Place the client in the left lateral position. Restrain the client to prevent injury. Insert the tongue blade in the client mouth. Document the timing. Which one should be a priority? You're walking and they're trying to fall. Prevent injury. Lay them on your left side, and that will help them. And this is caring for a client who's experienced tonic-clonic seizure and does not have IV access. We have to give them medication. Which route should the nurse administer medication first? IM, nasal, perirectal, and oral. If I can't give you IV, what is the fastest I can give you the medication? What is the fastest? Think about it. Safe medication administration. Intranasal is the safest and the fastest. A client with T4 spinal cord injury has throbbing headache, flushy face, and diaphoretic, autonomic dysreflexia. I give you the content there. Which action should the nurse take? Select and apply. Remove all constrictive clothing. Place the client in left lateral position. Check for what? Bladder distension. Examine the rectum for stool impaction. Measure the client blood pressure. This is content, but you see, I changed the question. It's the same thing. Don't be surprised. I say remove restrictive clothing. The patient should be upright, not on the left lateral position. Check their bladder for distension. Check for stool impaction and measure their blood pressure. And this is assessing a client with Bell palsy. That means paralysis of the one of the face due to cranial nerve what? Think about it. 7. Which finding is consistent with the diagnosis? Lack of tears on the affected side. Unable to close your eyes on the affected side. Facial drooping on the affected side. Loss of forehead and brow movement. Electric shock like pain when rubbing your face. Frequent blinking of the eyes of the affected. What do you think? I want you to pick your answer and let me know. But this is the lady with the Bell palsy. One face is paralyzed. What are you going to take? What are you going to pick? Lack of tears. It controls lacrimation. So 1. You're not going to be able to close your eyes. You close your eye closer to. It is responsible for your eye closer. Facial droop of the affected side. This is also going to be affected. Your forehead is not going to move on that side. If you have any pain, electrical, because you have no sensation, there should be no pain. So electric shock like this is trigeminal neuralgia. Frequent blinking of the eye of the affected side is not going to be moving. So why would you frequently blink it? It's not going to be moving. So 1, 2, 3, and 4 are your right answer. 75. Neuro, and this is performing high exams on a client with the eye injury. Which cranial nerve should be assessed for extraocular movement, high movement? Which nerves? 3, 4, 6, 5, and 2. This is straightforward neuro movement, extraocular high movement. What do you think? The answer choice? What do you think? 3, 4, and 6. Therefore, 3, 4, and 6. 6 are your right answer. 5 is trigeminal neuralgia, and 2 is just a vision, optic nerve. And next is teaching a new graduate about presbycusis. What is that? Which of the following the nurse should include in the teaching? Hearing loss, right? Select or apply. This is sensory hearing loss. Hearing loss is both sides and gradual. Refer to age-related hearing loss, difficulty with high pitch, and better with low pitch sound than high pitch sound. Think about it. Hearing loss. What do you think? You don't have to select everything. But it's sensory neuronal hearing loss. It can occur in both and slowly, gradually. That's why older patient, both of them, they can hear, or sometimes one, but one, the other side is still in trouble. It's age-related. That's where it came from. It's usually difficult with high-pitch sound, but it's better with low-pitch sound than high-pitch sound. Therefore, all of them expected in the patient with sensory neural problems in the patient. Therefore, all of this is expected. Case study. And let's review the clinical data and plan of care. Which condition is the what patient is experiencing? Which condition should you take, and parameters? This is a bow tie question. Client arrived in the PACU after 3 hours of hysterectomy. Client is alert, oriented, time, place, right? Temperature 98, heart rate 110, blood pressure this. Lung clear, S1, S2 present, is getting 75 ml. Fully urine output is fine. Then at 30 minutes later, patient is visibly short of breath. Why? Labored breathing, his jaw is locked, end-tidal CO2 is elevated, very stiff and warm to touch, right? Temperature, tachycardia, blood pressure is high. We're having what? Autonomic dysfunction. What do you think? I just had surgery, all of a sudden, locked jaw, breathing issue, end-tidal CO2, stiff, warm temperature. My temperature is high to 103. And then what? Irregular heart rate and blood pressure. What is going on with me? Do I have thyroid storm? Do I have serotonin syndrome? Do I have neuroleptic malignant syndrome and malignant hyperthermia? This is bow tie. How do you answer bow tie in the next generation NCLEX? Find the diagnosis. When you find the diagnosis, find the action you should take and use the action that you take to monitor it. That's all. So what do you think? This patient, we were not told they had surgery on thyroid. Therefore, take it out. Serotonin, patient is not taking SSRI or anything like that. Take it out. Neuroleptic malignant syndrome, well, it's not taking antipsychotic. Therefore, that is gone. Therefore, this has to be malignant hyperthermia. If it's so, what are we going to do? What is our priority? We're going to give you dantrolene to prevent the effect. And then cardioversion, because of irregular, you're really struggling. Or aggressive cooling as much as possible. Which one do you want to do? Then if you have to monitor, do you monitor the temperature or a mental status or urine output and heart rate? So let's look at the question. Malignant hyperthermia is our answer choice. And therefore, we're going to give you dantrolene and cool you. Your temperature is too high. And then we're going to monitor what? Your temperature and your mental status. That's the major problem. This is a bow tie question, malignant hyperthermia, and that's the way you actually approach it. Now, a few pharmacology again, coming back because I think it's very important. And as I attend the staff education, but this pharmacology is risk reduction. And as I attend the staff education program about antibiotic pharmacology and hemodialysis. Which of the following antibiotics should the nurse hold and give it after dialysis? That means the medication, if you give it to them, dialysis will destroy it. Gentamicin, vancomycin, penicillin, ceftriaxone, and erythromycin. I want you to write these down. If you don't know, the key concept is small, water-soluble, and low protein are the most common removed by what? Dialysis. So these are few medications. One of them is gentamicin, is very small, water-soluble. Vancomycin, small, water-soluble. Penicillin, small, water-soluble. The rest of them are big. So know them, know them, know them. And this is monitoring a client with allopurinol. We saw that one, sulfur drug. Which finding is most concerning? Problem: nausea, rash and fever, increased urine output, and joint pain. Stephen Johnson is a majority of the major problem associated with what allopurinol. It causes stone, it causes a bunch of problems, but which of these should you worry about? Nausea expected, increased urine output, I love it because it causes kidney stone. If you pee in with good. Joint pain, that's the purpose is using it for your big toe. Fever and rash, Stephen Johnson. And this is caring for a client receiving propofol for sedation, right? Which finding should the nurse monitor most closely? Hypertension, dilated pupil, tachycardia, tachypnea. Propofol is for sedation. What does it do? Even if you don't know, you have two options, hypertension and hypertension. One of them has to be the right answer. So which one are you going to pick? Hypertension. That's what it costs. We have 3 more questions. Are you ready? I know you're ready. What is your score? I know you're getting above 65. A client with multiple sclerosis is prescribed baclofen, which indicate the medication is effective. Increase muscle what? Rigidity. Decrease muscle spasticity. increased cognition, and increased deep sternal reflex. Baclofen is a muscle spasm. Therefore, what? If I give it to you, what is going to happen? Decreased muscle spasm. Two more questions. A client taking lithium report recently reducing their sodium intake. What do you tell them? Which statement explains the increased risk of toxicity? A low sodium decreases lithium excretion. Low sodium prevents lithium working from working. Low sodium improves kidney clearance. Low sodium is safe within lithium. I can tell you, you want to maintain sodium normal, otherwise lithium will cause what? Toxicity. Therefore, low sodium, decreased lithium. Is it okay? Which statement explain increased risks? When you have low sodium, the excretion of lithium is decreased and the lithium build up and you have toxicity. And the last question. Pharmacology. Risk reduction. Thank you for getting to 85. It's 83 because we did the case study. What do you think? The client diagnosed with C. diff infection. Which medication should the nurse anticipate administering? What is the actual medication for C. diff? Ampicillin, acyclovir, metronidazole, tachycardia. Once again, thank you for watching. If this video helped you, put down your comment in the comments, small comment to improve our channel, and subscribe for more content and share the video. Best answer, metronidazole. 85 question, NCLEX practice question, NCLEX review question, concept, most commonly tested using common sense approach. Thank you for watching and good luck in your exams.